So you're welcome to this session. We are going to talk about pharmacology in public health. So this is basically our first session, where we are going to look at what pharmacology is, what it deals with, and its application or its relevance in the field of public health. So that is basically what we shall be looking at. So pharmacology is a discipline that is concerned with the study of drugs and their interactions with living organisms. So we basically look at how drugs are discovered, developed, and then used to treat diseases. It means that we need to have knowledge of how our bodies actually work. That is, we need to have knowledge in physiology. We need to have knowledge in biology, chemistry, and medicine to be able to understand how drugs actually impact on body systems. So it is quite a wide field that looks at all those aspects. So we need to first look at the terms and their meaning. So the first term that we are going to look at is a drug. A drug is basically any substance that can cause a physiological change when it is administered to one organism. So the physiological change can be in terms of the vital signs. That is, it can change the temperature, it can change the blood pressure, it can change the heart rate, okay? It can change the levels of particular molecules in the body, the level of glucose, for example, or it can result into metabolism of certain biomolecules in the body, okay? So drugs can cause a variety of physiological effects or physiological changes in organisms. Then the next term is what we call pharmacotherapy, which is basically the use of drugs to treat, diagnose, and prevent diseases. Okay, so now using drugs to bring about a therapeutic effect is what we call pharmacotherapy. Whereas therapeutics is a branch of medicine that is concerned with treating diseases and managing the patient, basically, or providing patient care. Okay, so the next word there is what we call toxicology, which is the study of the adverse effects of drugs or even other chemicals on living organisms. Okay, so any preparation, any chemical preparation that is used to bring about a therapeutic effect is what we call a medicine. Okay, so it could be a liquid, could be a solid, it could be gaseous, as long as it is a preparation that is made to basically treat conditions or bring about therapeutic effects, then we call it a medicine. Another term that we also look at is pharmacokinetics, which is the study of the drug movement within the body. Okay, so how the drugs are handled by the human body, what you term as pharmacokinetics. And then pharmacodynamics we are looking at the effects of the drugs on the living organism, and also how they interact, how they work, how they interact with others, and how they cause side effects or adverse effects. And then pharmacogenetics. This basically focuses on the fact that not all people will have the same responses when administered with the same drugs. So there is variation in response, and that variation would be because of genetics. So looking at how drug responses are influenced by genetics is what you call pharmacogenetics. And then pharmacy is a profession concerned with preparing, dispensing, and use of medications. So the scope of epidemiology, that we look at the effects of drugs on the body at different levels. We look at the molecular level, how the drugs attach themselves to receptors and being able to cause a change in either the synthesis or breakdown of certain molecules in the body. And then the second level, the cellular level, which basically looks at the impact of drugs on cellular processes and signaling. The number of processes that take place in the body, impulse transmission, conversion of different molecules, that is biosynthesis, and also by breakdown of molecules into smaller components. There is also communication between cells. So how do these drugs result into changes in these cellular processes? That is looked at the cellular level. And then at the systemic level, we look at the effects of drugs on the organs, the organ system, and the whole body. Okay. So in our discussion of pharmacology, we shall look at many aspects, including pharmacodynamics, pharmacokinetics, and also aspects of clinical pharmacology. We will also look at concepts that are actually very relevant to public health. So those include issues to do with drug development, issues to do with drug policies, issues to do with the pharmacovigilance and pharmacoepidemiology, okay, issues to do with drug abuse. Those are areas that we are actually going to look at in this module. So where do we get drugs from? Drugs can be gotten from natural sources. That is, we can get them from plants. For example, we can get morphine and digoxin, Taxol from plant sources. We can also get them from animals. For example, insulin can be obtained from pigs, and also heparin. And then we have microorganisms that can produce antibiotics such as penicillin, streptomycin, and erythromycin. We can also modify these drugs through biotechnology, and then we call them synthetic drugs. So we modify them chemically, and then we become what we call synthetic drugs or semi-synthetic drugs. So drugs have different names. This is supposed to be names. One drug can have two names. We have what we call the generic name, and then we have what we call the trade name. We commonly encourage health professionals to always use the generic name. The generic name is basically is for example, paracetamol. Paracetamol is a generic name. So if you have we have different companies across the world that can make paracetamol. For them to stand out, like to be known that this paracetamol is made by this company, then they have to create what we call a trade name. Okay, they can create a trade name. So you have drugs with the generic name, which is basically related, sometimes related to its chemical structure, and then also the trade name. Some drugs can have a combination of what we call active ingredients, and therefore they can have a name that contains two, what you can say, two of those active ingredients. So that is what we can term as a combination drug. So like we said, one of the branches of pharmacology that we shall look at is what we call pharmacokinetics, which deals with how the body handles the drug. So we look at the absorption of the drug, which is basically if the drug is administered to a living organism, how is it how does it reach the bloodstream? And then we also look at its distribution, how it is carried throughout the blood, throughout the body via the bloodstream. How does the body handle it? How does it break it down? That is metabolism. And then we look at how it is eliminated from the body. Is it through urine? Is it through sweat? Is it through other mechanisms? So we look at those aspects in pharmacokinetics, and we shall have a separate lecture on that. And then we come to pharmacodynamics, which is basically looking at the effects of the actions of the drugs on the body. So we look at how the drug works, that is the mechanism of action. We look at how it combines with the receptors, that is drug receptor interaction. We look at how does it bring about the healing effects, or how does it bring about how does the drug bring about the prevention or the treatment or the management of a particular condition. And sometimes these drugs also cause unwanted effects. So how do these unwanted effects actually happen? We also look at those aspects. So drugs can be classified based on a number of criteria. So we can have what we call chemical classification, or that is looking at their chemical structure. We can also classify them according to their therapeutic use. For example, antihypertensives are those that are used to lower blood pressure. Those that are used to treat infections caused by bacteria called antibiotics. And then those that are used to manage pain are called analgesics. So we can also classify them according to their mechanism of action. How do they bring about the therapeutic effects? Is it agonistic? That is not working against a particular molecule or enzyme, you can say that. And then, or is it inhibiting a particular molecule from being manufactured, or is it inhibiting a particular enzyme that is antagonistic? For example, the enzyme inhibitors. Okay, so this classification is very important because it tells us about what we expect in terms of the drug properties, how the drug is used, and the potential side effects of the drug. When we talk about dosage forms, we basically refer to the fact that the drugs come in various physical forms. They can be liquids, they can be solids, they can be semi-solids, or they can be aerosol. So they can come in a variety of forms. So we have tablets, which are solid capsules. We have solutions, tinctures, suspensions, injections, and those that we apply, the ointments, the creams, those are topical forms that we apply on our skin, plus the gels. Okay, so those are the different forms of drugs, different dosage forms. The dosage forms actually influence the ability of the drug to be absorbed, how easily can it be taken, and a number of other properties in terms of how fast they will be absorbed. So the dosage form affects a number of drug properties. So administration of drugs, when we talk about administration of drugs, we refer to how the drugs are given to the patients. So we have a number of ways, the oral route, that is through the mouth, the topical, applying on the skin, inhalation, breathing, and then injection, and then rectal. We have many others routes of administration. We shall also look at that. But basically, the routes of administration influences drug absorption. But also absorption itself is influenced by a number of factors such as the pH, solubility, blood flow, and the dosage form, or what you call the drug formulation. Okay, the dosage regimen means how frequent that medication is supposed to be given in terms of timing and frequency. These are very important. You need to take into consideration issues to do with age, weight, and the medical condition that you're treating when you're giving any drugs. So how do we relate pharmacology to public health? Basically, when we look at pharmacology in public health, we look at the use and the effects, outcomes of drugs in the context of the population health. So what is the impact of using certain drugs on the general population health? So we look at a number of things. We look at the side effects, we look at the therapeutic effects, we look at the long and the short-term effects of these drugs on the population and what that means. And that helps us in designing pharmacological interventions that have impact on public health outcomes. Basically, the interest is that the drugs should be used in a proper way in the population. If they are not used well, then we could have issues like drug resistance or resistance to antibiotics, for example. We can have what we call non-adherence. We can have a lot of drug abuse. Okay, so we want to make sure that the drugs are used well and what are their impacts on the population. So basically, we look at those aspects and they help us to design interventions that that can improve the use of these drugs within the population. Sometimes you have drugs not being used well because of a number of reasons. Maybe the dosage form is not the appropriate one, causing a lot of difficulties to the patients. So you may need to modify the dosage forms. Yet, actually, these interventions are very important. Okay, so you need to look at how safe are the drugs? Do they cause the impact that we actually want? Are they cost-effective? Okay? These are areas that we actually explore when we are looking at pharmacology in public health. So we have actually looked at the fact that the drugs are used to improve health. Okay, but if they are not used well, then they can also have consequences on population health. But basically, in pharmacology, the public health wants to address the impact that demographics, environmental factors, and other health disparities have on drug interventions. Okay, so if you look at, for example, immunization, it is actually a drug intervention or vaccine intervention. What's the impact of the environment, and what is the relationship between vaccination and health disparities? Now, so these are areas that we actually look at when looking at pharmacology and population health. So we can design research designs, or can implement research designs, or carry out research to understand the extent to which drugs are actually having influence on people's health, and then be able to design the appropriate interventions. So it is very important for several reasons, because generally the drugs have to be used to prevent and control diseases. Okay, and therefore we need to make sure that the drugs are used very well, such that they don't cause harm, but also maximizing efficacy. So if we use them very well, then we are going to get optimal health outcomes. So we are using drugs in the right way. We are optimizing the drug utilization, and the different populations are actually having access to these drugs that they want. But also this understanding of pharmacology is very important in designing public health interventions. So we base our decisions on the public health interventions based on evidence that we collect. So that is why pharmacology in public health is actually very, very important. The challenges are that we have a number of challenges in public health that are actually addressed by pharmacology. Imagine if we didn't have vaccines, what could happen? A lot of people could be dying. But because of pharmacological knowledge, a number of infectious diseases have actually been eliminated because of the vaccines. And the vaccines are developed as a result of having developments in pharmacology. And then also, if you understand the effects of the drugs on the patients, you'll be able to understand why some patients are not actually adhering to the drugs. So it gives us very good knowledge on why patients are not adhering to particular drugs and while adhering to others. We can also understand the causes of drug resistance, which is a very big global health problem. Drug resistance is a very big problem in public health. So we can address that problem by understanding the mechanisms, the mechanisms of drug resistance, and be able to act on them. But we also want people to use drugs appropriately. People can misuse drugs, and that is what we call irrational use of drugs. So that marks the end of this presentation. We have basically looked at the fact that pharmacology in public health is very important because it allows us to understand the impact or the effects of drugs on population health. If we understand that better, it means we can address some of the challenges caused by irrational use of drugs. We can generate evidence that can guide us in addressing some of these challenges associated with antibiotic resistance or drug resistance, challenges associated with adherence to medication, and others. Thank you very much.